So it's incredibly exciting that Bronson is getting a chance to uplift and celebrate Hispanic Heritage Month this month. It means a lot to me as a Latina physician, knowing that less than 6% of physicians in the United States identify as Latino, and less than 2.4% of them actually identify as Latina. So it feels incredibly exciting to be able to highlight those of us that are working in medicine.
So being able to have a provider or a nurse or a social worker or somebody walk in the room that understands your culture, that can speak your language, there is a different sense of just warmth and trust that comes into the space as well. And I think then it makes for obviously a better therapeutic relationship. And then it continues to domino from there, I feel like, by that patient telling their family and friends, I went here and I got really great care. This is who I worked with. It felt comfortable, it felt safe. And then hopefully expanding then more people having access to care.
So I am QBS 3 Spanish, so that means that I can actually interact in Spanish with patients. And every time I just walk into a room and it's like a Hispanic patient and they see me and I introduce myself in Spanish, it just makes a difference. They feel like they're more connected, that they're being heard and just valued as a patient. And I feel like it just makes their experience here better as a patient. And it just makes me happy to be able to help others that are like me.
So for me, one of my big goals in representation here in medicine is, one, to really provide a safe place for our Latino patients, to have someone that identifies and recognizes their culture, their language, their family, their style, their food, and to be able to have that sense of trust and safety within the medical system, because it can be incredibly intimidating and incredibly scary sometimes to step in, especially to the hospital systems. But I also hope to be that person that I didn't really get to see much growing up, which is a female physician who was able to do it and has been able to overcome a lot of the difficulties it takes to get through medical school without too many people that look like you and sound like you and understand you. So I'm really hoping to continue to support people as they continue to look at the medical field and grow in it.